Hi everyone, welcome back to Game Pharmacology. In this session, let us learn about some of the important drugs that regulates calcium and how this will be helpful in the treatment of some of the conditions. So welcome back to Game. Myself Dr. Padmanabha TS, Faculty of Pharmacology. So first coming to the Cinacalcet. So Cinacalcet, under this, what you need to remember is basically it will going to decrease the calcium. So they're called as calcinomimetic, please remember. So they can ask in your exams, so which is the drug which is called as calcinomimetic, which is a fluorinated compound, and these are also called as calcium sensing receptors. So these calcium sensing receptors are present on the parathyroid cells. So when there is an excess of calcium, so this will going to sense the calcium levels in the plasma through the calcium sensing receptors. So very important to remember is, so which is a drug which will going to sense the calcium levels in the plasma whenever there is an increase in the calcium levels in the blood. So the drug which will going to detect the higher levels of calcium in the blood is the Cinacalcet by their calcium sensing receptors, which are present on the parathyroid cells. Basically it will going to inhibit the parathyroid secretion. So please remember, it will going to inhibit the parathyroid hormone secretion and decreases the parathyroid hormone itself, as well as calcium also, and also the phosphate. So the half-life of Cinacalcet will be around 30 to 40 hours. So let's move on to the uses and adverse effects. So since it reduces the calcium, it can be used in conditions where there is a increase in calcium. So as the examples are the secondary hyperparathyroidism due to renal disease or renal pathology, where there will be increased calcium, and also in case of the patient who are on long-term dialysis, and in case of inoperable cases of parathyroid carcinomas, you can go with the Cinacalcet. The only drawback of Cinacalcet is they can cause tetany-like symptoms due to the hypocalcemia. How to remember? Cina means you can, I means it inhibits what is Ca? Calcium levels in blood, or it inhibits the calcium levels or the concentration in the blood. That means in the blood it will going to decrease the calcium levels. So because of this, there can be a risk of tetany due to hypocalcemia. So this was about the class on Cinacalcet. Thank you.